we're gonna do our gallbladder. We know that sits in a different location for every patient, but we're typically gonna look in that right upper quadrant area. We know it sits in our main lobar fissure, so we're gonna see that surrounding liver tissue. So traditionally on most patients, you're gonna kind of start with your sagittal plane of the gallbladder. We know that that organ sits in weird positions, so we don't want to be strictly sagittal and transverse. We want to follow the sagittal and transverse of the organ. So because the gallbladder sits on an angle in the liver, we're going to mock that angle. So typically for a sag gallbladder, we're going to start with our transducer in that angled position. My notch is pointing up towards her left shoulder. And let's see what that gets us. And then similar to the pancreas, we're going to sweep under that rib cage and back to try to find that organ. So let's see where we're looking here. So here we have her sagittal gallbladder, nice and elongated. If you look at where the transducer is, you can see it's steeply angled underneath her rib cage. We're still in that oblique angled position. We're not in that true sagittal transducer position, but we're sagittal to our gallbladder, to our organ. So we have the gallbladder neck down here. That's going to taper to form our cystic duct, but we don't see that on ultrasound. We have the body, that mid portion, and we have the fundus up here. Now it's a fluid-filled structure. We know that we want it to appear anechoic. We don't want any echoes in it. So we want to try to clean this up before we take these images. We have some echoes up near the fundus portion. So we're going to use our TGC and we're going to clean that up so everything is nice and anechoic and we're not making up any debris in that gallbladder. So this would be a great sagittal gallbladder picture for you to take. You see the surrounding liver tissue on all sides. You see the nice echogenic wall of the organ. You can see the neck, the body, and the fundus. We don't have any echoes in there. She doesn't have any pathology. So that's a good picture to take. You can take some variations of that sagittal. You can sweep under her rib cage even more and get more of a lateral approach of a sagittal. And you can sweep in towards her belly button a little more and get more of a medial approach for the sagittal gallbladder. Now going into transverse, you're going to stay on your organ and you are going to turn your transducer counterclockwise. So we're going to rotate our transducer, watching our organ turn on itself. Megan, take a big breath in and hold. And we're going to see that transverse gallbladder in that nice circular shape. So if you look at my transducer now, we're almost opposite that angulation that we had for the sagittal. So we want to forget what our hand is doing for a second and we want to focus on what the organ is doing. So we know in transverse we want the cross axis of the organ, so we want it nice and round. So this is a good transverse. Sorry, I didn't tell you to breathe. Another big breath when you're ready. And I'm sweeping through that organ. I'm sweeping still under the rib cage and back down towards her belly button. And we're going to stop in that mid portion, that body or that fundus portion. You're going to take your transverse images, and we know that we do a wall measurement in transverse. We measure the anterior wall outer to outer. We want that less than 3 millimeters. So we're going to measure that echogenic wall, and she's at 1 millimeter, so that's good. Similar to sag, you can still take some variation images. Big breath when you're ready. And you can take some, this is going to be our inferior portion of the transverse gallbladder near the neck. You can sweep up higher under the ribs. That would be more of our fundus, more of our superior portion. So you can take pictures sweeping along in that transverse plane. Now when we're looking at the gallbladder, we also want to be looking for our common bile duct. We know that that is going to empty out the gallbladder and it's going to go on to travel into the duodenum after it meets with the pancreatic duct. So it's pretty important. And we're going to stay in the same position, but it's a little bit more tricky to find. So you're going to have to search around for a little bit for a second. Big breath in and hold. Okay. So here we have transverse. This is how I like to find common bile duct. We have transverse gallbladder. I sweep up a little bit under her rib cage, I'm going to find her porta hepatis, her portal vein here, and I'm going to turn my transducer towards her right shoulder. I put my color on to confirm. That's smaller. Ready? My portal vein here. We know that the common bile duct runs parallel with it. The hepatic artery runs on a slight angulation, so that's my hepatic artery there. Scale's not that great on our color Doppler, but that's gonna be our common bile duct right here. So really small. We can zoom that in even further to this anechoic tubular structure right on top of our portal vein. Different than the gallbladder wall measurement, we measure this inner to inner. So we're going to measure from the inside portion of the echogenic wall to the inside portion of the other echogenic wall. So she is at less than a millimeter for her common bile duct. So that's fine, that's normal. So let's zoom out a little bit and kind of see what that general location looks like again. So we have our transverse gallbladder here. We're using that as our landmark. We're sweeping up slowly so we get to the porta hepatis. Just adjusting my settings here. We have our portal vein coming into the liver, sitting parallel, right on top, common bile duct. Here she's measuring about 2 millimeters. So you're gonna get a little variation depending on how you're looking at it, but as long as it all appears and measures within normal, not any cause for concern. Okay, you can, And then also when we're doing our gallbladder, we like to turn our patient on their side. So we're gonna have our patient turn into a left lateral decubitus. So Meg, you're gonna turn up onto your left side. Okay. Perfect, she's on a slight angle. She's not fully up on her left side. She's on about a 45-degree angle. And you just wanna adjust how you're scanning at this point because as we know, all of the anatomy inside is gonna rotate a little bit. So you just wanna go ahead and take a second to find it and see how it lays in this new position. So here we have our sagittal gallbladder in a decube position. Same thing, we want to make sure that we're nice and anechoic. And then just hold your breath. So here we have our elongated sagittal gallbladder. It looks longer than it did in the supine position. That's because it's kind of stretching with this new position, and that's totally normal. You're going to see a little bit different shape when you have your patient move. So we have our neck down here. It's a really nice neck there. We have the body, and we have the fundus. And same thing, you're just going to turn on that sagittal organ. You're going to turn counterclockwise until you get your transverse. And same thing, you're still sweeping through superior to inferior, making sure that no masses or stones have popped out since that patient has moved. If you can't find the common bile duct while the patient is supine, you could try to attempt it with them in a decube position as well. You're going to do the same thing. You're going to find your transverse gallbladder. You're going to sweep up a little bit under her rib cage so you get to the porta hepatis. You're going to find your portal vein and your hepatic artery, and you're going to be looking in that region. So you want to play with your transducer angulation, and you want to go on an oblique plane. You're still kind of angling towards her left shoulder, her right shoulder. Still going to be sitting parallel to the portal vein, just on top. So it's anechoic tubular structure here. Really small, really narrow.